Good afternoon or good evening, everybody. My name is Ali Hirji. I work at Durham College at the Artificial Intelligence Hub, as well as at the Center for Cybersecurity. It is my honor and a pleasure today to be welcomed by the town of Ajax to host this session. The purpose of today's session is to help kids understand what is COVID-19, what is the coronavirus, and how can we understand all of the data, the numbers, the graphs, the charts that you're seeing on the news, that you're seeing online. How can you understand this? Little Doctors Club Canada is a group started by Zehra and Alvi. They're students at the University of Toronto School, so that's the school, not the university itself. And they started off this club with the intention of helping kids have fun while learning about health-based topics and medicine-based topics. Their hope is to continue a series of lectures and sessions through the summer, and they'll be starting off an initiative where you can get badges depending on which exam and which credential you're able to pass in the Little Doctors curriculum. So without further ado, I'm going to announce a couple of people and introduce them to you. We have Ali and Zehra, of course. Hi, Ali and Zehra.
Hello.
The speakers for today. We have Marilyn Crawford, Councillor and Deputy Mayor in the town of Ajax. Hi, Marilyn.
Hi. We
have Ruchi Rajkumar and Mauricio from Durham College, who will be managing the chat and social media for the day. And we also have Andrew and Lisa from the town of Ajax who have helped bring this session together. Before we begin, I do want to remind you the session is being recorded. We have about 30 people here, so we are at the capacity we expected. The session is being recorded and will be posted online. Secondly, if you have a question, you are on mute. Please post your questions in the chat bar at the bottom here, and I'll be sure to help you. Before we begin, I want to introduce Mayor Shaun Collier because he is instrumental in bringing a lot of these education initiatives to Ajax. Mayor Collier, I'd like you to say a few words and welcome our guests.
All right, thanks, Ali. Good evening, and thank you to you and the AI Hub and everyone for joining us today. You've introduced my council colleagues, which is great, so I don't have to do that, so thank you. Welcome, everybody. I'd just like to begin by expressing that now, more than ever in our history, one second, I lost my notes here. More than ever in our history as a community, we need to stay strong together, and this includes connecting and supporting our residents and businesses during the COVID-19 pandemic. This has been the most challenging circumstance facing people of all ages all over the world. On April 6th, I declared a state of emergency in Ajax, and this is not a step that I took lightly. It means we need to be aware that we're in a very serious situation, and we all need to do our part. It's the strongest tool available to us as a municipality to help people make wise choices to combat the virus. The town continues to keep you up to date on the latest Ajax impacts at ajax.ca/COVID-19 and on all our social media channels. We're grateful for the support of our frontline and healthcare workers and businesses, so everybody keep going strong. I understand and recognize the stress and pressure that everyone's under right now, and that's why the town of Ajax has taken several steps to try and slow the spread of the virus. We're hoping that by working together, we can get our town back on track as quickly as possible. And what better way to explain why this is important than to have kids explain it in terms we can all understand. For the session this evening, I'm pleased to have the help of two young people who you've introduced, Zehra and Alvi, I hope I said that right, you two, who will walk us through the details of COVID-19 in a way we can all understand. So thank you everyone again for joining us. And Ali, I'll turn it back over to you and the AI Hub to get us started. Thanks a lot.
Thank you very much, Mayor. And before we begin, I do want to make note that I forgot to introduce Councillor Ashmeed Khan. Ashmeed, you are on mute as you are a guest, but I will say, Ashmeed, you've been a great supporter of the AI Hub, both from Global Cyber Olympics to CISO Forum to everything else that we've done. So thank you, Councillor Khan, for joining us, and we'll make sure to end on time so that you can go and enjoy some iftar and post some lovely pictures on Facebook for all of us. Marilyn Crawford, the show is yours. You have your questions. We'll turn it over to you to get started.
Thanks, Ali. I just wanted to also mention that Councillor Lisa Bowers has joined us. She's down there in the corner. Just give it a big shout out to her too.
Hey, Lisa.
Okay.
Hi, Lisa.
Okay. Are you ready?
Yeah, we're ready.
Ready. Okay, so I've heard that there's a difference between the COVID-19 and actually the coronavirus. Can you explain to everybody what the difference that is in that?
Yeah, for sure. Okay, so
I'm sure you've all been hearing the terms coronavirus and COVID-19 on the news, or your parents have probably been talking about it. These two words are being used a lot, and usually we hear them interchangeably, but there's actually a difference between them. So coronavirus is the name for a large group of viruses. Many of these viruses are not new. It's a large family of viruses that can cause illnesses in animals and humans. In humans, coronaviruses are known to cause respiratory infections. So respiratory infections that may interfere with normal breathing. It can affect your upper respiratory system, which starts at your sinuses, which are high in the nose, and ends at your vocal cords, which are in your throat. It can also affect your lower respiratory system, which starts at your vocal cords and ends all the way to your lungs. The symptoms can be very similar to a common cold or the flu. Some examples of coronaviruses that we already know are severe acute respiratory syndrome, which is SARS, and Middle East respiratory syndrome, which is MERS. The most recently found coronavirus is the coronavirus disease that we're all facing, COVID-19.
So that being said, COVID-19 is a strain of the virus. COVID-19 is actually an acronym for Coronavirus Disease 2019. It's the infectious disease that is caused by the most recently discovered coronavirus. This particular virus is new and was unknown before its outbreak in Wuhan, China in December 2019. As we all know, COVID-19 is now a pandemic that is strongly affecting many countries all around the world. So the clarification is that coronavirus is a large group or family of different viruses, while COVID-19 is this particular virus in that family that we are dealing with. So both terms are correct. However, coronavirus is a more general term as it's regarding a group of diseases. So that's why COVID-19 is the more accurate name for the disease.
Fun fact, it's called coronavirus from the Latin word corona, which means crown, because of its crown-like shape.
Well, there you go. Thank you very much. Ali, do you have anything to add to that?
There better not be a test or an exam after this. So, Ali and Zehra, I did want to ask you though, you used the word pandemic and then you said it spread around the world. Can you talk to me a little bit about what do you mean by a pandemic and who decides that something is a pandemic or not?
So the World Health Organization usually decides this, and a pandemic is usually it's a disease that's prevalent over a whole country, like around the world. So it's not just a targeted community or group of people.
Okay, thank you very much.
Yeah, so, a virus is considered a pandemic by either WHO, which is the World Health Organization, or America's Center for Disease Control.
Okay, thank you. That's good to know. Thank you very much. No, Marilyn, I think I'm good there. Why don't you move on to the next question, because that's all about the data and stuff. Yeah.
Okay, yeah. What do we mean when you hear the term data? What are they talking about? We see lots of talk about on the news about the curve flattening. What does all of that mean, really?
So data almost always represents numbers. These numbers are about the amount of people who have died, been infected, or have recovered. By seeing these numbers, we can learn a lot. In our current situation, all we hear about is flattening curves and seeing graphs about the number of deaths, or Ontario versus other provinces. So let's take a look at this graph. The x-axis, which is the horizontal line, represents the amount of time that has passed. The y-axis, which is the vertical line, represents the amount of infected people who need medical care. This graph shows us that because treatment capacity and early containment measures were low at the beginning, there were a lot of deaths because quarantine and other preventative measures weren't being properly enforced, and infected people were not being treated efficiently. So you can see this as the high amount of purple that goes down, and then the dotted line, which is representing the cases that didn't receive treatment action. But then we can see that over time, the treatment capacity and early containment measures increased, which is represented by the yellow line, and that patients were receiving treatment, which resulted in less people dying. And you can see that as the green coming down and the curve is starting to flatten. This shows that with the preventative and containment measures that we are taking, such as social distancing and shutting down public areas, we are actually decreasing death rates. From the graphs, we can tell when the virus plateaus and when it spikes. So when we say the virus plateaus, we mean that the curve on the graph has flattened or stabilized. This means that the data has stopped increasing and is progressing now at a constant rate. When we say that the virus has spiked, this usually means that there's a sudden increase in the amount of data.
So from this next graph, we can see that on May 1st, we had reached 55,000 cases in Canada. The most updated number to date is about 60,000 cases. As we can see, Ontario, which is the light purple, and Quebec, which is the darker purple, make up the majority of Canadian cases. But why is that? Well, we can look at the difference between them in data of Ontario and British Columbia. So Ontario has 8 times as many cases as British Columbia, and approximately 10 times more deaths. But what caused Ontario's numbers to be so high? Well, the main reason is population density. Population of Ontario is 14.5 million people, while in BC, the population is 5 million. So obviously Ontario has a lot more people who can be infected. Then we need to take a look at how many people are in the capital city. Toronto has a population of about 3 million, while Victoria, which is the capital of BC, has a population of 92,000. So Toronto's population is also very diverse, with people from all over the world, and there's a lot of tourism and immigration. From these two things, we can see that Ontario has many people in a smaller area, while in BC, the population is lower and more spread out. So going back to Quebec, we know it also has a very high death toll from COVID-19. This was surprising at first, as Quebec's population is lower than Ontario, yet they have more recorded deaths. The reason why Quebec has so many deaths is because it has many nursing homes and long-term care facilities. Its high death toll was due to these facilities, because older people are more likely to die from the virus.
Okay. Is there anything else you need to add?
Yeah, there's a question that I see here where it says, Haley would like to know where on the graph do we have to get to see each other again?
Good question.
Alvi or Zehra?
Well, it needs to come down to 0.65, and it's up to the government's discretion. They need to figure out when they think it's safe for us to come back out again. Because if we do go out, the numbers are gonna start increasing again, because we're getting more in contact with people who sometimes the symptoms of the virus aren't visible, so we don't know who can actually be a carrier or not.
Interesting. Ali, do you want to add anything to that?
Yeah, so basically, in a more simple way, we can't start going outside until the numbers have significantly dropped. Because still, we have people who don't know they have the virus because the symptoms are not visible.
All right, thank you. I had another question for you. So you spoke a lot about the fact that it's concentrated in Ontario and in Quebec. Could you explain a little bit more, because that's one of the reasons that they've shut down the airports, so they've limited travel. Can you talk a little bit about why do they need to do those kind of things? Why is it that I can't catch a flight outside of to head somewhere else from Ontario?
Yeah, great question. So basically, if we opened up the airports again, we would get a lot of people from other places, and we don't know whether or not they have the virus, unless we test every single person. So by bringing in more people who potentially have the virus, we're increasing the chance of the virus to spread.
Okay.
Or even if you want to take flights out, we can't be sure that you're not a carrier, because as I said before, and I'll talk more about, is that the symptoms aren't visible all the time, like from this beginning. It takes a while for the virus to incubate in the person, so you need to have it for a while for you to start showing symptoms.
Thank you. Now you use some words that like incubate and you need to have it for a while. Now these are words that I think we need to explain a little bit more. So can you take a couple of minutes to explain? I know we have other questions, but I will take a couple of minutes to explain What do we mean by somebody is a carrier, the virus has to incubate? Talk to me a little bit about this.
So the virus needs to stay in your body for a while, which is what I mean by incubate. So it needs to start spreading and taking its effect on the body for someone to start showing symptoms. And usually during this time, people are most contagious to others, which is why this virus is getting really out of hand.
Okay. Ali, do you want to add anything to that? Ali, did you hear the question?
What?
I was asking, do you want to add anything to what Zehra said?
Oh yeah, sure. So basically, like Zehra said, the virus takes a while to take effect on the body before we'll start seeing the symptoms that we know are related to coronavirus, which are the dry cough and fever.
Okay, thank you, Ali. Marilyn, do you want to go on to the next question? I think Marilyn has dropped. She did mention saying she was freezing on the screen a little, so I'll take over from Marilyn. That is not a problem. So Ali and Zehra, just making sure you can hear me okay. Ali, can you talk to us a little bit about kids were told you can't go to parks now. We're not allowed to go to school. You can't go out to play. There's so many limitations. We cannot see our friends. And the kids in Ajax have been following that. They've tried not to go to the parks. They've tried to stay connected with their friends online. Why was that important? And why is it that by not going to the park, something as simple as that, I'm able to contribute and fight against such a complicated disease?
Yeah, so the number of new cases has stabilized at around 1,400 to 1,600 a day, which is roughly the same number as the start of the month. And by April 30th, the national rate of increase has slowed down by 3%. So what that means, slowing down by 3%, is that if there were 100 cases before, there are now only 97 cases. Yeah, I know this might seem like a small number, but when we spread it out over a larger scale, it's rather significant. And this represents a lot of people. It shows that by these small things, not going to the park and so on, improvement is happening, and that the precautions that we're taking are slowly yet surely helping the situation.
And I'm sure you all want to hang out with your friends again. Maybe you're not missing school, or maybe you are. So why do we have to be in quarantine? Well, let's cover the reasons behind social distancing. This virus can spread from person to person through small drops from the nose or the mouth when an infected person coughs or exhales. So if these droplets come in contact with you, for example, if someone sneezes or coughs near you, you can get the virus from them. These small droplets can also land on surfaces, which means any person that touches these surfaces and then their eyes, nose, or mouth can become infected. So to stay safe, we need to be social distancing and avoiding getting near groups of people. So some math behind this is that before quarantine started and when people weren't taking proper precautions, one infected person would infect 2.5 people in 5 days. These 2.5 people would then infect 2.5 more people, and so on until after a month, there would be 406 infected people. You can see in the graphic that when people cut their social interactions by 50%, they would infect only 1.25 people in 5 days, and 15 people would be infected by a month's time. With quarantine, I think we can say our interactions are cut at 75% less than usual, because we can't go to stores or parks, meet up with friends. Even our grocery trips are limited to every once a week or so, depending on your family. So our social distancing is having a major impact on reducing the number of people who will get infected. An infected person now will only infect 0.625 people, which really means they either infect one person or zero.
Interesting.
So if an infected person...
Is that what they're talking about? Oh, sorry, go ahead.
No, that's fine.
Go ahead.
Oh, okay.
So I was just going to say, is that what they're talking?
It's okay, you go.
Marilyn, go ahead.
I was just going to ask about asymptomatic. You hear that word being thrown around a lot. Is there any way that you can maybe explain that too?
Yeah, so asymptomatic means that you have contracted the virus, but it hasn't incubated, which Zehra described what it means. So it hasn't been in your body long enough for you to start displaying the symptoms of COVID-19. Yeah, so if an infected person stays at home or like if we stay at home, avoiding potential carriers of COVID-19, we won't be in risk of getting the virus. This is why these social distancing protocols and quarantine are so important to the improvement of the current conditions. Everyone really needs to be taking these protocols seriously because we all need to work together in fighting this virus and keeping ourselves and others safe. And because these rules weren't followed in certain countries, the spread has overwhelmed the healthcare systems. But because you did your part by staying home, avoiding contact with people outside of your family members, staying that 6 feet apart, we've been able to get a control over the spread of this disease.
I see a question in the chat, and I want to bring that up. So Tyler is asking, is it safe for me to go to an open soccer field and kick a ball just to get some exercise? Zehra, Ali, can you talk to what is considered safe and what is not?
Yeah, for sure. I think that's a really good idea because we were going to talk about later on too that it's really important for us to be getting physical activity even if we are in quarantine. So that's totally safe as long as you're not coming in contact or you have to keep a 6 feet distance between other people. And then make sure you wash your hands when you come home and try avoid touching your face and contacting surfaces when you're outside. But other than that, that's a really good idea. You should definitely be going out as long as you're safe to get physical activity.
Yeah, so it's fine to go play soccer, but it's recommended that you don't play with anyone else.
That's not soccer, but sure, I get your point. All right.
Soccer with Ellen.
Good, Ellen. Is there any more that you want to add to this slide, or shall we go on to the next question, Ali? Or is
Yeah, let's move on.
Okay. So I know that you had another question which you had sent to me directly, is you wanted to talk a little bit to kids about what do you need to do to continue to stay safe, and what are some things that could be happening in the future. So Zehra and Ali, why don't you talk to that?
Yeah, so the scientists and the World Health Organization are working very hard to develop a vaccine. If we want things to improve, we need to continue on our social distancing practices and improve our hygiene and sanitation. We all need to be following protocols, such as staying 6 feet away from each other, avoiding group gatherings, avoiding touching our faces, and frequently washing our hands.
So we need to make these habits our new norms because it is going to take a while for us to go back to what normal was before the outbreak. The problem with this virus is that there are so many unknowns. And even if we do find vaccines, viruses tend to adapt and change, meaning they can possibly evolve to fight off the vaccines. We're going to have to implement new precautions, like having plexiglass shields in grocery stores or grocery carts being routinely wiped down, wearing gloves and masks outside, limiting the number of people in a building at a given time, or for us kids to have our desks in school further apart, meaning less students in each classroom. So this is definitely going to mean change and transition, but it's our only hope to get this virus under control. So even if social distancing practices need to continue, this doesn't mean that we can't see our friends again or that we can't have fun. It's going to get better, and we will be able to hang out with our friends again, but it'll just have to be with distancing. So we want to tie this into what we can do to stay healthy during quarantine time. So there are so many things we can be doing to stay healthy, even in quarantine. Just because malls and parks are closed doesn't mean there's nothing we can do. We should definitely try to reduce the time we spend sitting. I'm assuming based on my personal experience that a lot of us are spending time sitting, whether it's doing schoolwork, reading, watching TV or Netflix, scrolling through social media, or even gaming. We should be taking short 5-minute breaks for every 20 to 30 minutes that are spent sitting. Even by just standing up, stretching, or even better, going for a walk around the house or to your yard can improve your health and well-being. This can also help improve your concentration if you're doing work, because people tend to start procrastinating and getting distracted when we spend too much time sitting still.
Yeah, you should also be getting some physical activity during the day. By setting up a regular routine, planning a break, or setting up a time online with your friends for physical activity are all great ways to ensure you're staying active. This will help you build a routine to adjust to quarantine life and keep you healthy. This is also a great way to stay connected with friends or to be active with your family. You can schedule time with others to be active. Video calling with friends and doing the exercises together, or going on walks and bike rides with your family are all great ways to be social and active at the same time. You can also be setting goals for yourself. For your physical activity, you should set realistic goals that you're just going to try and reach. These goals should challenge you and motivate you to do your best. You can also record your progress and even reward yourself if that helps motivate you. Thanks for your attention.
So, Ali and Zehra, just if you can go back to the slide where you were talking about how the virus spreads. And I've got a couple of questions that have come to me on WhatsApp. So, Marilyn, I'll just go through those questions as well as what's on the chat, and then you chime in as and when necessary. So, the dear Zehra, who's the daughter of a really good friend of mine, lives in Ajax. She's asking, so I looked at the data. Why is it that we're seeing that there are more seniors who are at a higher risk of contracting the virus and, dare I say, die from the virus than kids? Can you talk a little bit about that?
So yeah, as we know, the virus can infect everyone in every age group. So it's not just seniors or just kids getting infected. But the reason why seniors are more likely to die from the virus is because the older we get, the weaker our immune systems get. Our immune systems work hard to fight off any virus or infection that we may pick up. And as we age, it gets weaker. So when elderly get the virus, their immune systems aren't strong enough to fight off the virus, while a younger person might be able to.
Ali, is there anything you want to add to that?
Yeah, this is what happened in Italy, because in Italy, in the houses, there were a variety of different age groups, young and old. So then the younger people who are more likely to contract the virus because they go out more, contracted the virus and spread it to the elderly people who are more likely to die of it.
Thank you. There's another question that's come out, and there are actually a couple that have come, one from Ashish, but let's go to the one from Lucas. Lucas would like to know, can I contract coronavirus from food?
So the virus stays alive on hard surfaces for a few hours, but we haven't heard that the virus can spread from food items. So it's really the packaging that we should be worried about if there is a small chance of getting it. So you can wear gloves when you're going to get your grocery stores and wipe down any packaging you have before opening it. But I don't think, nothing has been discovered yet that you can get it from eating food.
Thank you, Zehra. Another question that has come in, and this is from my student Ashish, and this was something that I was going to ask you, is there's a lot of fear right now where we're hearing, even Mayor Collier was talking about, we'll open up things but slowly, and we need to be careful because there could be a second wave of this virus. What do we mean by a second wave? And a lot of people are talking about the second wave could be a lot harsher than the first one. I know you don't have slides about that, but if you can just talk organically about what is the second wave all about?
Yeah, so as we see right here, 75% less exposure is where we're currently at, where one person is unlikely to affect another person. It's just 1-to-1 at most. If we had a second wave, that would mean we would be returning back here to our first step, where we're infecting just as many people. And they're saying that potentially it could be worse, where we could be infecting way more people.
So basically it's that we've contained it for now because we have cut down we've cut down so much that we aren't spreading it because we have less exposure. But as things start to open up again, people are going to start going out again. And it is possible that people who were contagious but weren't aware of it start spreading the virus again. And a second wave is basically just all of this happening all over again. And it could even be worse. And this happens with a lot of pandemics. I'm pretty sure the influenza pandemic, which is the flu that happened in 1918, I think it happened with that. There was a second wave that hit again. So that's what it means by a second wave.
Yeah, and that's why it's so crucial we don't just open everything immediately and take it slowly, step by step.
Okay. Thank you, Zehra and Ali. Marilyn, there are more questions that are coming to me on WhatsApp, so I'll just keep plowing through all of them. And Marilyn, please jump in at any point of time, okay?
Sure.
All right. So I don't know if you can answer this. And of course, Ali and Zehra, there's a reason you're little doctors. You're getting there to know almost everything you need in healthcare and medicine. But if you don't know the answer, just say it. So there's a question here saying, should I be worried about my pets? I have 2 cats and they're very small. Could they catch the coronavirus? And the reason that this kid is asking the question is because you mentioned at the start that this may have also come from animals. Can you talk a little bit more about this? And I think you had a slide as well, sort of talking about transmission and where the virus came from. Maybe you want to use that slide.
So there were actually tests done about this that we did do research on. There were several dogs and cats that came in contact with infected humans that had tested positive for COVID-19. And it shows that the cats and dogs can spread to each other. But from what we know right now, COVID-19 is spread through human-to-human transmission. So you should, if you do find yourself to be infected and you have to go into the self-isolation period, you should avoid contact with your animals. But if you're fine, I think for now it's okay to keep your pets there.
Yeah, so it's similar to what we're saying about going outside. See, if your pet has come into contact with another, most likely animal that had coronavirus, it's likely that they'll contract it too. Also, there's proof that the virus can live on the fur of animals. So then after touching your animal, sanitize your hands.
Point noted. Thank you. And I'm glad, I'm impressed that you had such details about that question. So thank you for that. Questions are consistently pouring in, so I'll just keep going through all of them. I do want to come back towards the end in the next 10 minutes, a little bit about data and AI and coronavirus, and we'll talk a little bit about that. But let's take all the questions from the kids now. There's a question from Kiran that says, is it true that corona or COVID-19 will calm down during the summer because of the warm weather? Great question. I mean, all of them are great questions.
There's no proof that temperature will affect the spread.
Interesting.
Yeah, we are at the point where we don't know whether temperature has an effect on the virus because there are still so many unknowns about it, and we have just discovered it, as we said, in December 2019. So scientists haven't figured out yet what that means in terms of temperature-wise and with the virus.
Yeah, just something else. It started in China during the summer, so.
Interesting. Okay, that's a good point to keep in mind. Keep staying on that topic of safety and how to keep yourself protected. There's a question here about, we're hearing a lot about masks and wear a mask and how to wear the mask and N95 mask. A mask is a mask as I see it. Can you talk to us a little bit about what are the differences between these masks? How should you be wearing it? I've seen some things talking about don't roll it up and then bring it back down. Can you talk to us a little bit about how to use a mask and which masks are preferred?
Yeah, so N95 masks are medical masks. Like, preferably, we should be giving those to healthcare professionals because they need it the most. For us, we should just be using the normal standard medical mask that you see with the blue strap and the elastics.
And
so when it comes,
keep going.
So when it comes to removing masks, we should avoid touching the front of them and just remove them from the back and then dispose of it and then sanitize.
Okay. Zehra, were you going to add something to that?
Yeah, I was just going to expand on how to properly put on a mask.
Sure.
So before wearing a mask, you should wash your hands with an alcohol-based disinfectant or with soap and water. You have to cover your mouth and nose with the mask to make sure that the mask is firmly pressed against your face. You shouldn't touch the mask while you're wearing it. And if you do, wash your hands again after you take it off and replace the mask as soon as it gets wet, and don't reuse disposable masks. The whole point of the mask is it's going to take if you do come in contact with the virus, it's supposed to protect you from taking it in. So don't be reusing those masks. And when you remove the mask, remove it from the behind and don't touch its sides and its front, and throw it away in a container that's closed and wash your hands again after.
I have a question about masks. So there's a lot of people that are making homemade masks. How do you know if you have a good mask? How can you tell what is a good mask, especially the homemade ones?
Yeah, so you want your mask to be tight, but not so tight that you can't breathe. Also, you want to make sure that what you're making the mask out of is a clean surface because you're going to be breathing through it. Also, people were asking whether cloth masks are something we should be doing. And the answer is yes, because any coverage is better than none.
Yeah,
So
cloth. Oh, sorry.
I just wanted to say, when you wear a mask, are you keeping people from getting a disease perhaps that you might already have, or are you preventing yourself from getting the disease?
Good question.
You're preventing others, yeah.
Sorry?
Because it's preventing your droplets from spreading.
Okay.
So as we said, when people cough or exhale, it's the droplets that come out of our mouths that spread this virus. So when you're wearing the mask, it's making sure that doesn't spread to other people.
So if I can, Riley asked a question about when she can go and play with her friends again.
Yes, I missed that one. Thank you for catching
Okay.
that. Sorry.
Yeah, no problem.
Yeah, so when we'll be able to go back out again is unknown so far. So what we're saying is the best way is to do it digitally. Try and set up a Zoom meeting. And even when the government does say that it's okay to go out again, we should be wearing masks, wearing gloves, and maintaining the 6 feet.
Okay. Thank you, Ali and Zehra. I'll go on to, there are 2 more questions. Sorry, it's a question from Maya, so thank you, Maya. Maya's asked a question saying, can mosquitoes and flies carry this virus?
I'm not sure of
Not
that.
that we know of.
Okay, fair enough. We can look into that. And if you hear something else, Zehra and Alvi, please post it on your Twitter and Instagram so that the kids can follow you and get a response from them. We'll go to the next question. This comes from Tyler. Tyler wants to know, great, thank you for talking about masks. It's a face shield, and are those necessary to wear as well?
So face shields are like, there's an elastic band and a large plastic sheet that goes over.
Yeah.
So those, they're not recommended. They're not better than the normal surgical masks.
It's an extra precaution that you can take, but it's mostly for hospital and frontline workers who are really coming into contact with people who could be infected.
Okay. Great point. Thank you, Ali and Zehra. So I've got one last question that I've got on Twitter, and then we'll see if there are any more, and then we'll take it from there. Is what can I do if I know somebody who is suffering from the virus, or I know or my friends are a little scared and they're nervous? What do I need to be talking to them about? Zehra, Ali, you want to give it a try?
Do you want to go or should I?
You go.
So if you know someone with coronavirus, and as much as you want to be able to go be there for them and help them, you really need to keep away from them. But you should make sure that over the phone you can talk to them. You need to keep them hydrated. And if their condition does progress and worsen, they should, after their isolation period, they should definitely get support, go to the hospital or call a hotline for help. But if it's just that they're starting to have symptoms, they should just go into isolation. It doesn't necessarily mean directly go to the hospital.
Okay, thank you. Ali, do you want to add anything to that?
Yeah, just the most you can do is be supportive to them.
Yeah.
Comfort them.
Yeah, I would agree. Now, I expected this question to come earlier, but it's come in now to me on WhatsApp. And the question is, how much do I need to clean my house? And why is it that people are running around for toilet paper and Lysol? Zehra or Ali, can one of you take that on first?
Yeah, so it's about panic. People are going crazy over stuff. For some reason, they think it's all gonna run out and stop being available. The more we do this, the more we make that idea of running out a possibility. So only do what you think is necessary for getting stuff you need. Don't stockpile.
Yeah.
As far as sanitation goes, the more you do is better, but don't go around sanitizing your walls. It's not necessary. Only surfaces that you often touch.
Yeah, surfaces, you can get it from surfaces, but if you haven't had people in your house and it's just been your family that you know for now are safe, you don't need to be sanitizing, like Ali said, the walls or like everything. but washing your hands is definitely something you should be doing often, especially because people tend to touch their face a lot, and I know I do this and my mom gets mad at me for it, but I keep my hands on my face, I touch my face, my nose, and spreading the virus can happen through that. So we should be washing our hands and try avoid touching your face.
All right, thank you very much. More questions are pouring in, so I'll just keep taking them. I'll take both of them and I'll just say it in one go. So there's one question from Kieran asking you about, does drinking warm water kill the disease? Please address this, as well as please remind people and kids not to drink Lysol. That's very important. And secondly, is COVID toes a real thing? Zehra, do you want to start?
Drinking, we don't know what kills the disease, and that's why scientists are working so hard. Like, scientists at WHO haven't been able to find a vaccine to kill the disease. So I'm gonna say, based off what I know, warm water does not kill the disease from what I know.
Yeah.
Ali, do you have anything to add to that?
Yeah, no, I don't know where this came from, but there's no proof displaying this, that warm water kills the disease.
All right, thank you, Ali. Now let's go on to the question on COVID toes, though. This has been in the news. Zehra, do you want to start with what the COVID toes is?
I've seen this too, where they have a COVID toe, which shows like toes getting reddened from people who have coronavirus. I don't actually know what causes this and if that's a real thing, but we will definitely do more research on that and respond to it later.
Perfect. Thank you, Zehra. Ali, was there anything you want to add to about COVID toes?
No, I don't really know much about what COVID toes are.
Okay, fantastic. That's fine. So feel free to post about that on your Twitter and Instagram, or at least your Twitter, and we've already been following you, so that we can, if you have any information to share about that, please do on Twitter.
Yeah, we'll definitely get back to you guys.
I remember something about scientists saying it's not much of a respiratory issue.
It's rashes that are developing on the body.
Yeah.
But we don't know much about it right now.
Yeah. So just read up on it and come back to you. Maya's asked another question, which we'll take it really quickly. When you get mail, can it have virus on it? And I assume what she's talking about is people still are ordering things that may be coming in from different countries. But I think, if I'm not mistaken, what you suggested is if you're getting mail, if you're getting boxes, clean it first, wipe it down, and then open. Correct?
Yeah, because the virus can be on surfaces, but not for a long time, for a couple hours. So if you do receive something, you should definitely wipe it down and wear gloves when you're handling it at first.
Fantastic. All right.
And if you don't want to be using your cleaning stuff on the mail, another way to do it is let it sit in sunshine for an hour.
Interesting. All right. Thank you, Zehra and Ali. So it's 6:47 now, and I did want to end this soon because I know the mayor has to be somewhere else, and I have another engagement as well. So let's jump right into the close now. So Ali and Zehra, with Little Doctors Club, the next event that you're going to be doing is at the Cyber Exchange, where you're going to be talking about mental health and kids. And this is because you want to look at topics around, now that kids are spending more time in front of the screen, spending more time in front of computers and doing more computational stuff, you want to talk to them about their mental health. Can you take about 30 seconds each to talk to them about why mental health in kids is such an important topic?
There you can start.
Okay.
Yeah.
Well, like I said before, we're spending a lot of time sitting and staring at screens, which is not good for us. And there's the 20-20-20 rule, which means every time you stare at a screen for 20 minutes, you should look away 20 feet just to make sure you're still okay. And you should be getting physical activity. And right now, there's a lot of panic and anxiety that can be happening with kids, especially kids who don't know too much about the virus. And that's what we want to discuss at that meeting. Just what we can be doing, there's not much, you shouldn't be panicking, and things you can be doing to keep yourself calm.
Okay, thank you very much. Ali, do you want to add anything to that?
Yeah, so since the schedule that kids have been going on, where they go to school, come back, do their work, it's all been shifted around. Whether you have school, whether you don't, it's becoming harder to cope with it. Because once it was that you had to go to school, they'd check your work, a lot of kids are having trouble doing this. So then we want to address how it's affecting their mental health.
It's also that we're spending a lot of time online and indoors, and it can be dangerous. So we want to discuss too how to be online and be safe while you're doing it.
Fantastic. So that will be happening at the Cyber Exchange, and all of the details will be going online soon. If people want to register, I've added the link there. There'll be other phenomenal speakers for kids as well. Tanmay Bakshi will be doing a session on learning to code. We'll have IBM doing their Cyber Day for girls, looking at different topics around cybersecurity and kids. So please feel free to join those sessions. They're completely free. And we look forward to seeing all of you there. Now, with this said, I also want to take just 2 minutes talking to you about why is it that we brought you this session while talking about AI in Ajax, but we also brought you this session. The reason, kids, that we brought you to this session to talk about AI, to talk about health, to talk about COVID-19, is to think a little bit about what artificial intelligence is. You see all of these numbers that you're seeing there: 5 days, 30 days, 406 people infected, 2.5 people infected, and all of this stuff. All of these numbers are little pieces and data of information that a computer can use to run different models, to run different predictions. Let me give you an example. For example, if you're using Netflix, and I use this example all the time, when you watch a particular cartoon or you watch a particular movie, Netflix has a point that says so-and-so person, let's take Zehra for example, watched this movie and that movie and this movie and that movie. Netflix is able to use artificial intelligence to then tell you, hey, since you watched all of this, we recommend you might be willing to watch this movie as well. This is what AI does. It looks into the future. It makes predictions. Previously, we would tell a computer what to do. Today, you give a computer lots and lots of data, and it decides what the best decision could be. I want all of you kids to start thinking about how AI is going to factor in our world, because AI is going to help a great deal with the social distancing stuff. For example, a lot of kids now will start seeing stuff around virtual health. People are now visiting doctors but doing it virtually. Somebody wants to show that they've got a scratch somewhere, they want to see if it's bad or what's wrong with it. They're showing it over a computer. They're sending pictures that are analyzing, but through software, are analyzing those pictures and telling you what you have. Likewise, AI models are being used to tell you how much traffic there's going to be in one area and how to maintain social distancing. So start reading about what is artificial intelligence, what is computer visioning, how do computers detect one person from another, how can a computer tell you what you're going to watch and you quickly say, wow, that's so true to what I like to watch. How are computers coming up with these decisions? This is really, really important for you because going into the future, more and more of this AI is going to be used to deliver services. So with that said, I'm going to close this up by inviting you again. Please join us when we do the Cyber Exchange. If you have any more questions, you can reach out to us on Twitter as well as on Instagram. And one last thing. Over the summer, the town of Ajax, our friends in Niagara, Durham College, will be hosting a whole bunch of sessions, summer camps for kids. We're going to be announcing some stuff with Tanmay Bakshi, which will also give you credentials, but we're also going to be offering some stuff with Little Doctors Canada. So for example, we'll be offering 3 days or 3 sessions where you can learn, for example, about the brain, another 3 sessions where you can learn about the heart. Once you learn and once you enjoy in these gamified environments, you'll be able to take a small test. If you get the test, you pass it, you get a badge that brings you into a little level in the Little Doctors Canada Club. Alvi and Zehra are starting off Little Doctors Canada and are trying to grow it across Canada. I invite you to follow them on social media. If you have questions, reach out to them. And I suspect you're going to be seeing a lot more of these 2 kids as they go around Canada teaching kids about how to be healthy and learning more about medical practices. With that, I'll turn it over to Mayor Collier if you would like to say any closing comments. Mayor?
Well, thanks, Ali. And I got to tell you, Ali and Zehra, I'm very, very, very impressed. You guys did such a great job. Very knowledgeable. I happen to be pretty up to speed on COVID, and all your things were absolutely bang on. You guys really know your stuff. It's great. And I actually learned something new as somebody who spends a lot of screen time these days because everything we're doing is now online. I did not know about the 20-20-20 rule. So I will be practicing that now too. So thank you. I did learn something valuable tonight as well. Ali and Marilyn, thank you very much for sort of emceeing this and asking your questions. It was great. And we at the town of Ajax are just, it's an amazing partnership with Durham College and the AI Hub and Ali. And I'm looking forward to continuing this with so many other things. So thank you everyone for joining us tonight.
Can I just say thank you for all of the kids that joined in the participation that everybody had. It was awesome. And if you really like this, I think we'd love to do more of these sessions, just kids talking to kids. It's a great platform, and I think we're going to have this platform for a little while now. So
yeah.
Thank you, Ali.
Absolutely. And anybody has any ideas, kids, just send us a note. And if you have other sessions you want us to do, just, as Andrew calls me, just reach out to Uncle Ali and he'll get it set up for you in some shape or fashion. The folks at the town have been amazing to help support you. So if there's different things you want to learn about computers, about COVID-19, about medical stuff, we've got something for you. Just reach out to us and we'll be more than happy to help you out. The recording will be posted on our YouTube channel. Keep it at the AI Hub on Twitter and Instagram and you'll get notified of it. With that, I will wish you all a very pleasant evening. To those that are fasting, have a nice and healthy iftar. And we'll see you all very, very soon. Take care.
Stay safe, guys.
Thank you.
Bye.